In this podcast episode, Dr. Mark Hyman welcomes Dr. Darshan Shah, a pioneer in the field of longevity medicine and the founder of Next Health. The conversation revolves around groundbreaking advances in healthcare, particularly focusing on a therapy known as plasmapheresis, which has the potential to significantly enhance health and longevity. Dr. Shah shares his personal journey from being a traditional surgeon trained at prestigious institutions like the Mayo Clinic to exploring the realm of functional and longevity medicine. He expresses his growing frustration with the limitations of conventional medicine, where he often witnesses patients seeking surgical interventions without addressing the root causes of their ailments. This experience leads him to seek alternative methods of healing, ultimately inspiring him to create Next Health, a facility dedicated to innovative health therapies. Plasmapheresis is a medical procedure that involves the removal of plasma from the blood, which is the liquid component that carries various proteins, nutrients, and waste products. Dr. Shah explains that the procedure has been used for decades to treat autoimmune and neurological diseases, but its potential for enhancing overall health and longevity is just beginning to be explored. The therapy works by removing inflammatory biomarkers and toxins from the bloodstream, thereby reducing inflammation and allowing organs to function optimally. Dr. Shah highlights the historical context of bloodletting, an ancient practice based on the belief that removing bad humors could alleviate disease. Modern plasmapheresis builds on this concept by scientifically targeting the harmful components in plasma, such as damaged proteins and inflammatory markers. The procedure not only cleanses the blood, but also rejuvenates the body, potentially reversing chronic diseases and improving overall vitality. A significant portion of the discussion centers on the role of inflammation in aging and chronic diseases. Dr. Shah emphasizes that inflammation is a common pathway for many age-related conditions, including heart disease, diabetes, and Alzheimer's. He notes that the accumulation of inflammatory markers in the plasma contributes to the aging process, leading to a decline in health. Research shows that removing these inflammatory components through plasmapheresis can lead to measurable improvements in biomarkers associated with aging. Dr. Shah shares compelling stories of patients who experience significant health transformations after undergoing the procedure, including improvements in heart rate variability and reductions in inflammatory markers. One of the most exciting applications of plasmapheresis is its potential impact on Alzheimer's disease. Dr. Shah discusses studies indicating that the therapy can slow the progression of cognitive decline and even reverse some symptoms. By removing toxic proteins associated with Alzheimer's from the bloodstream, patients may experience improvements in memory and cognitive function. Dr. Shah also mentions ongoing research exploring the effects of plasmapheresis on other conditions, such as long COVID, where patients often experience lingering symptoms due to inflammation and immune dysregulation. The therapy shows promise in alleviating these symptoms, providing hope for those suffering from post-viral complications. During the conversation, Dr. Shah explains the importance of albumin, a protein that is often replaced after plasmapheresis. Albumin plays a crucial role in maintaining oncotic pressure in the blood, and has the ability to bind to toxins and damaged proteins, facilitating their removal from the body. By replenishing albumin, patients enhance their body's natural detoxification processes. In addition to plasmapheresis, Dr. Shah highlights other therapies available at Next Health, including hyperbaric oxygen therapy, infrared sauna sessions, and cryotherapy. These treatments leverage the concept of hormesis, where mild stressors stimulate the body's healing mechanisms, promoting cellular regeneration and overall health. Dr. Shah envisions a future where healthcare is divided into two distinct systems, one focused on disease management and the other on health optimization. He believes that as more people become aware of the benefits of therapies like plasmapheresis and functional medicine, there will be a shift towards a proactive approach to health. This new paradigm empowers individuals to take charge of their well-being, utilizing innovative therapies to prevent chronic diseases before they arise. The conversation concludes with a call to action for listeners to prioritize their health and consider the potential benefits of therapies like plasmapheresis. Dr. Shah emphasizes that while these treatments may not be widely accessible yet, the growing interest in longevity medicine is paving the way for more options in the future.